Okay, we're going to start now. Good afternoon. Just give me a second here. All right. Good afternoon and welcome everyone to our fourth and last NLAAD 2020 webinar. I'm Luis Mares, the Director of Community Mobilization Programs at the Latino Commission on AIDS and coordinator of the National Latino AIDS Awareness Day since 2017. We are very happy to be able to end this year's series of webinars with such an important topic as it is U equals U, undetectable equals untransmittable. All people living with HIV have a right to accurate and meaningful information about their social, sexual, and reproductive health. And U equals U is a concept and a message that will help to reach that goal. Through our webinar today, we will learn about the scientific basis of this concept and the importance that U equals U has in the lives of people living with HIV, reducing stigma, and also about the need that we all have to promote and deliver this message to everyone. To talk about this important topic today, we have my fellow U equals U ambassadors, Davina Di Corner and Ariana Lin, mi paisana. But before going on with the webinar, it's a little housekeeping, details, and some information about the NLAAD 2020 campaign that is ending. This webinar is being recorded, so please, everybody who is not muted by any chance, silence your microphones and write your questions in the Q&A section. Do not do it in the chat box because it gets lost and it's difficult to find. This presentation and the recording will be shared with all of you after the webinar. People always ask for it. It will be shared with all of you. So this year has been our 18th NLAAD campaign. We started in 2003 with our efforts to create awareness among the Hispanic Latinx community about HIV, and now also supporting the ending the HIV epidemic plans at every level, state and national, where U equals U is one of the main components and pillars to reach the goal of ending the epidemic. October 15 already passed, but I still ask you to promote our campaign by posting and tweeting about NLAAD, the posters, the infographics, the events, and also the webinars in your social media accounts and platforms. Because even though October 15 is the central day for NLAAD, the work that we have to do about creating awareness is all year round. So earlier in the month of September, we launched the campaign. We sent an email blast with the posters. Probably you all received that email. This year, the NLAAD campaign theme is at your fingertips. With this theme, we wanted to remind our community that different to other viruses, to novel viruses, we have the tools to end the HIV epidemic at our fingertips, at the reach of our hand. Since science and medicine have made advances in this almost 40 years since the beginning of the HIV epidemic, we do not have a vaccine or cure for HIV, but we have many tools that we can use to put a stop to this epidemic. We have easy access to rapid testing. We have now preventive measures that work very effectively, such as PrEP, PEP, and the use of condoms. And also we have very effective treatment that improves the health of people living with HIV, allowing them to reach viral suppression, and therefore also eliminating the risk of transmission to sex, what we know as treatment and prevention, and also as U equals U. Each one of these tools are represented in the posters that we have this year. As you can see in this slide, there's one poster for testing, one for PrEP, one for treatment, one for use of condoms, one for U equals U, and this is the first time we had a poster specifically for U equals U, and one that combined all the factors to end the epidemic. With all these tools and measures, we can identify those living with HIV who don't know they have it. We can reduce significantly the risk of transmission, and we can prevent new infections. We also ask you to continue to visit us, our website, NLAAD.org, to browse the information about the campaign, the events that we had, the webinars, and about HIV testing, prevention, and treatment. The website is up all year round, and you can also have access to past webinars and materials such as infographics and posters and news related to the campaign and to HIV in general. This year, we have gone virtual because of restrictions due to COVID-19, and therefore a number of events around the country decreased as we expected it will happen. But we are very happy with the numbers of presentations and webinars that we have been invited to do for this year's campaign, increasing our reach to parts of the country where we usually don't go, It's like Hawaii, for example. And these are the posters of several of the invitations that we received to present and participate in Facebook Live events, in radio interviews, in TV, and in presenting webinars as well. Because of COVID-19, we couldn't organize our usual press conference at Staples City Hall when we congregate with our partners of New York City. So this year we presented a replacement to this press conference with this virtual briefing that I'm going to share with you. Let's see if it works. Yes, it does. So. Buenos dias and good morning from New York City at the New York City AIDS Memorial, where the epicenter of the AIDS epidemic was located almost 40 years ago. And welcome to NLAAD 2020. This year, because of COVID-19, we are not able to congregate. We are not able to be together as we always like at a press conference, a live press conference. So we decided to do this virtual press conference with information about NLAAD 2020, and we're going to give you we're going to bring you people from different parts of the country, from Hawaii, California, Florida, New York as well. So New York NLAAD 2020, we have the solution for this at your fingertips. You can see at every poster we have here, we have 6 posters this year with the information on every tool that we have to end this epidemic. Testing, prevention, PrEP, condoms, U equals U, and treatment.
So as a Latina female, I definitely feel that us getting tested and knowing what is happening with our bodies is definitely empowering. You feel the strength that you need to ask questions you didn't know the answer to. You're aware of how you can protect yourself and prevent anything new from occurring.
Greetings, family, from the New York City AIDS Memorial, a landmark that pay a tribute to over 100,000 people that passed due to HIV in New York City, the epicenter of the HIV/AIDS epidemic. But today we are here together, keeping some distance among ourselves because COVID-19. But our commitment to advance ending HIV, we strongly believe is by our fingertips.
Today is National Latino AIDS Awareness Day.
Sorry.
Black and Latino communities make up the highest rates of new HIV diagnoses in the United States each year. Together, we can end this epidemic. And as always, Black Lives Matter.
We're here today filming from Hilo, Hawaii, and we represent Kappa Psi Pharmaceutical Fraternity here at the College of Pharmacy. And we just wanted to share a little bit about why we decided to bring the National Latino Awareness AIDS Day to our community.
So the reason we're bringing it here is to try to break down the barriers and create an atmosphere where we can have an inclusive, diverse community and have access to treatments and prevention measures in place.
So through awareness, education, and breaking down the stigma, we can reduce the numbers of new HIV diagnoses in the Latino community.
Thank you.
Soy embajadora mundial de la campaña U equal U, que quiere decir que mujeres transgénero o mujeres o personas que viven con el VIH como yo y que tienen un correcto tratamiento y niveles indetectables en sus laboratorios por mucho tiempo, no transmiten el VIH a otras personas. Por algo es muy importante como misión personal y como misión de mi organización empoderar y quitar el estigma del VIH en mujeres translatinas a nivel nacional.
Currently, Latinos are the largest majority group in the United States. Our population is growing. Services. Get tested for HIV, and if needed, get treatment. Attend support groups and use resources available in your community.
We as Latinos, Latinas, and Latinx people need to talk about HIV. Tenemos que hablar con los jóvenes y hasta incluso nuestros abuelitos sobre el VIH y el sexo más seguro. We need to embrace and support those living with HIV. Somos apasionados y el amor corre por nuestras venas. Entonces tenemos que mostrarle a las personas viviendo con el VIH que los amamos sin condiciones. Ya, basta con la discriminación. El VIH no reconoce ninguna frontera. We encourage nuestras comunidades across the country to join us in this fight. Help us celebrate NLAAD by doing your part. We can't do it alone. Juntos somos más. Erradicar el VIH está en el punto de tu dedo.
Test often, know your status. Usa condón, previene el VIH.
Prep yourself. Prevent HIV.
Busca tratamiento, mantente saludable. And remember, ending HIV is at your fingertips.
October 15th is National Latino AIDS Awareness Day. Visit us at nlaad.org.
My apologies for the interruptions. I was trying to read the chat box, something happened. So you equals you have been part of our campaign for 3 years now. We have had in the past Bruce and Murray presenting about this. For today's webinar, you equals you, the message and the movement. As I mentioned earlier, we have Davina Corner and Ariana Lind. Davina began her advocacy work by way of internet radio, using her platform as an outlet to end the stigma that is associated with HIV. She now streams her show live in Facebook, educating others about the LGBT community, you equals you, the trans community, being a Black woman with HIV, and many other issues that the HIV community faces. In the last 4 years, Dee has become an international speaker, a board member of the Prevention Access Campaign, and a co-chair of Nevada HIV Modernization. She works closely with the Center for HIV Law and Policy on Criminalization, and is a co-chair for PWN Colorado and the Denver HIV Planning Council. Dee has an associate degree in public health at American Public University and has worked with various organizations, including ViiV Healthcare, the Janssen Advisory Board, Johnson & Johnson, Gilead, FHI 360, and is a contributing writer for HIV.net. She is committed to ensuring that those disproportionately affected by HIV get the necessary information. Ariana Lind is the Executive Director of Ariana Center, a community-based organization that provides advocacy, education, and training, case management, and linkage to care for transgender men and women in the South Florida area. She is a part of the National Board of Positivity Trans Prevention Access Campaign and the Well Project. She is a refugee and a lawyer from Lima, Peru. Ariana has spoken at dozens of trans and HIV-related conferences and has consulted for the White House National HIV/AIDS Strategy, CDC, and universities nationwide. She is an outspoken advocate for trans women living with HIV, you equals you, PrEP access in the transgender community, immigration, and social justice. Welcome, Dee and Ariana. It is a pleasure for us and for me personally to have you here collaborating and cooperating with NLAAD, which is what I do.
Thank you. Thank you.
Yeah, I'm going to stop sharing now. Here. And
okay, everybody. Hi. He introduced who I was. My name is Davina Connor. I am the creative engagement outreach specialist for U equals for Prevention Access campaign. And today we're going to talk about U equals you, the message and the movement, changing the narrative about living with HIV and loving with HIV. First, so what is U equals you? U equals you is undetectable equals untransmittable. People living with HIV who are on treatment and stay adherent to their medication, they then become virally suppressed, which means undetectable, and they cannot transmit HIV to their sexual partner. Next slide. So a defining moment in history. In 2016, we found out about U equals you, and they shouted it on stage at IAS conference. You know, many of us with HIV we can't imagine a time that we could have sex, or we could love, or we could have children. And U equals U has set us free from these fears. I know it set me free from these fears. Next slide, please. Where do U equals U come from? It is TASK, which is treatment as prevention, and it was pioneered in 2006 by Dr. Julio Montana. And then in 2016, it was pioneered by a community of HIV activists, researchers, and AIDS organizations to easily convey the science, which we now call U equals U, 10 years later. It's a perspective, descriptive, and empowering message that we must share. Next slide. Why is U equals U a game changer? Because it transforms social, sexual, and reproductive lives. But it also helps with the internal stigma that so many of us face and we're dying from for so many years. It has helped us in seeing us in a different way of how we feel about ourselves. It helps with that internal stigma, and it helps us to not let how other people view us be put on us. And how it can help us in clinical settings and policy decisions, how they're made about us in housing and education, unemployment. And the treatment goal is aligned with the 90-90-90 goal. Just knowing about U equals U, it can reduce anxiety about, for people who are trying to get tested, it reduces that anxiety as well. Next slide. Universal access. So we're going to talk about universal access, which is, it's a game changer. It provides a strong public health rationale to access and eliminates barriers to treatment and care and diagnostic, which we call the third U. So the third U is universal access. We all deserve access to care. Every single one of us, no matter where we live, no matter our race, no matter what country we live in. So it increases access to remove barriers to treatment. It also will help in the epidemic. So if we must get as many people living with HIV in care to get them virally suppressed and untreated, and if we can do this and get everyone to undetectable, we can no longer transmit HIV. And this is a great way to talk about U equals U with policymakers and with those who make decisions about where the funding goes. Using the argument that we're getting everyone into treatment will help in the transmission. To do this, we must increase access and remove barriers to treatment and barriers to care. This will improve the health and the well-being of people living with HIV. Because once they become undetectable and virally suppressed, it's going to prevent new transmission, again, to get us to end the epidemic. We have to use U equals U as a public health argument, you guys, when we talk about all these barriers. Next slide. So I want to talk about the Positive Perspective 2 study, PP2. The Positive Perspective study is one of the largest global HIV reported outcome studies today, involving over 2,300 people living with HIV. And the research explored aspirations and attitudes of a diverse range of people living with HIV with their healthcare providers. So I want to show you the next slide to show you how this outcome turned out. So informing people living with HIV about U equals U, healthcare providers now have a further incentive to inform people living with HIV about U equals U. The PP2 data does show us in a direct correlation to improve the health outcomes of people from the ones who were made aware of U equals U by their health care providers, they now have a better health outcome than those who were not informed about U equals U. And it's the treatment satisfaction was at 76%. The optimal adherence was at 80%. The self-supported virologic content control was at 77%. Next slide, please. I want to talk about Switzerland because they were the first country to endorse the message of being virally suppressed to people living with HIV and letting them know that they could not transmit. This was in 2008. This was what, 10 years ago? So they explained that people with HIV in Switzerland, they reported that they are the highest percentage of those that have been informed of U equals U by their healthcare provider. 1/3 of all people who are not told about U equals U by their healthcare providers, sad to say, is heterosexual men. And people living with HIV in Asia were far less likely to be given the information. Next slide, please. Why do we need and still need the U equals U campaign? First, we know that there is a lack of information about our bodies. There's lack of expertise with some of the people in the field who have authority to share the information and the knowledge. There are ongoing concerns about unsophisticated consumers who feel that some people with HIV won't understand U equals U. So then we hear them say that people with HIV will not have condom, will have condom, now have condomless sex. And people living with HIV, we know for years that so many people, not just people with HIV, but people in general have been having condomless sex for years. And regardless of U equals U, we know that people have been having condomless sex for years. We should focus more on saying that U equals U will not prevent other STIs and say that U equals U will only prevent HIV transmission. So we can't blame U equals U for condomless sex. We just can't. Next slide, please. Oh, I forgot, I'm sorry. We have to also talk about a lot of the prejudice and the stigma and in the HIV field. We could talk about the physicians who just refuse to share the information, saying we won't understand it and that we'll think that it's a cure. But what we need to understand is that we have to talk effectively to people so they can understand the message of U equals U. That is the only way they're going to understand it. And then resistance to change. Everybody has resistance to change, no matter what it is. It's a mental thing. So you have to work hard mentally to start to understand when things change. And Prevention Access and other people that convey messages of U equals U, we're here to hold your hand. It's like someone wanting to stop smoking cigarettes and the resistance to change. You have to constantly remind yourself that this is something new and it can happen. And we're there for you if you need us. Next slide, please. So we need the campaign because all people living with HIV have a right to accurate information about their social and sexual reproductive health. We all have a right to this. Disseminating U equals U is essential for personal and public health. Now this one here is HIV stigma is a public health emergency. People are dying. People are depressed. People are ashamed. People are living in shame because of HIV. And this happened years ago when the epidemic first came about. So it is a public health emergency. U equals U is an immediate effect for public health solution. Next slide, please. Tell the truth, or we're going to tell the truth for you, period. That's what we're going to do, and that's what we've been doing for the last 4 years. We're going to tell the truth. Next slide, please. Bringing science to the people. So a consensus statement was created with the researchers from 4 countries to clear up the mixed messages that confirm U equals U was absolutely true. So it's like having something up in an attic because the researchers didn't know that their message was not being conveyed. having something in an attic that had been sitting there, and finally somebody pulled it down, and now everybody is learning about U equals U. And so what happened was Prevention Access created a video of people with HIV from every single background because they wanted the truth about U equals U to be told to everyone living with HIV. So our strategy was to use the statement and the videos and our voices so the narrative can be changed about our bodies, and then influential people were engaged in the message and organizations, and they all joined us to confirm that we knew and we know that U equals U was true and is still true today. And so in 2016, we had organizations that first signed on, like in cities like New York and Terrence Higgin and Trust. So next slide, please. I love this slide. I really do. It shows us a range of individuals that all over the world who have conveyed U equals U in messaging and made it their own. And because of social media and the strong power of people with HIV and the people who cared about us all around the world, U equals U went global. International organizations, grassroots advocates, and they made U equals U look like them. They made it their own. And started promoting the message and wouldn't stop until the truth was told. Next slide, please. These are women in another country who only had resources to download information from ISA and printed U equals U messaging to share in their community. Next slide, please. And we can all do this. This is I love this one. I love this one. The movement brought people together from diverse backgrounds to sing, dance, march, and to talk about U equals U on the streets. And they're still doing it today. Next slide, please. Now, Dr. Fauci, the director of National Institute of Health, said the science really does validate, you guys. It validates U equals U. He said U equals U is the foundation of being able to end the epidemic. And he did this at the United States Conference on AIDS in 2017. So why would you believe the director of the National Health Institute of Health? Next slide, please. So this is going to shock you because it shocked me. The CDC released a statement stating that there is effectively no risk of sexual transmission when on treatment and undetectable. So effectively made people think that maybe there is a chance. But guess what they did? Last summer, they confirmed that U equals U is 100% effective in preventing sexual transmission. That is amazing. So they authorized the flexibility and messaging, including supporting the use of U equals U and prevention access messaging. This was huge and extraordinary for the CDC to assert that HIV prevention method is 100% effective, and then to endorse an outside nonprofit organization's work. Prevention Access is grateful for the bold and historic action that they have with us. Next slide, please. Now, this is the director of NIH, Maureen Goodenow. And she says U equals U is an essential component for ending the epidemic. People learn that U equals U, that they are more likely to get tested, to start and stay on treatment, stay on ARTs, bring health benefits to people with HIV, health benefits to their partners, and health benefits to the general public. Next slide. And the Department of Health and Human Services has signed on to U equals U, and they also convey the message of U equals U, and stating that people living with HIV can become virally suppressed and have an undetectable viral load and cannot transmit HIV to their partners. And they said this December 2019. Next slide, please. International agencies. We got the WHO, PEPFAR, CDC, UNAIDS, IAS, and the WHO recognizes that awareness of the treatment and prevention benefits of ARTs should be promoted in order to encourage HIV testing uptake and to support people to access and adhere to ARTs as early as possible. And they said this in 2018. We have to continue to convey the message of U equals U to get people back on treatment and to keep them in treatment so they can become virally suppressed. Next slide, please. This one right here. I know 4 years ago, Bruce Richmond was on my show, and we were excited that 20 or 30 people have signed on to U equals U. After 4 years, it's 1,005 partners that have signed on in 102 countries. How awesome is that? How awesome is that? Next slide, please. U equals U around the world. Let's see this. We're going to see all the different people around the world, or the ones that we have here that have conveyed the message. Now, in the United States, this was one of the first campaigns called the Positive Series campaign. They took 4 advocates, took their stories, their photos, and made characters out of them to convey the message of U equals U. And what you can do is go to this website, thepositiveseries.org, download these posters and put your own logo on them and put them in your organization or wherever you want to make U equals U look like you. U equals U is not about PAC. It's about the community. It's about advocacy. It's about all of us. So you can make these posters look like you. Next slide, please. Now we got Canada, England, Japan, Monaco, Zimbabwe, Vietnam, Australia, Nigeria, Italy, USA, Brazil. So many people in different countries are conveying the messages of U equals U. Next slide. Terrence Higgins Trust, one of the first countries to talk about U equals U. I started seeing them on Twitter, and they've made commercials and had parades and talked about it on TV and have just unbelievable how well they have done in the UK talking about U equals U. Next slide, please. I love this video here. People have had underwear parties conveying the message. I love that. You. Okay, next slide, please. And these are well-known people on TV, you know. We have a rugby player, Thomas Gard, who had learned about U equals U, and they talked about it. He shedded tears about this. Jonathan Van Ness on TV was talking about U equals U. You have Bruce Richmond and Chris Harry having a conversation about U equals U, and then they even talked about it on CNN. Next slide, please. Now, these are messages from New York. They were, I believe, one of the first U.S. States to sign on to the campaign. And I like this one that says made equal. HIV cannot be passed if the virus is undetectable. And then one says, I can't transmit HIV to anyone. So these are really nice. I really like these. Next slide, please. This one is one of my favorites. This is one of my favorites on Twitter called Go Low. So go low, sanantonio.org. Convey the messages of U equals U in a statement that just says go low. So they hashtag go low all the time. And then we have one from Mexico City, and then one from the Latin Commission on AIDS. So you can create your own and put them out there on social media too. Next slide, please. Oh, the one from Guatemala. I don't read Spanish, but I just love this one. I love the little cell back there in the back. So they're conveying messages in Spanish, you know, everywhere. Next slide, please. This one is from New Zealand. Drop your load. Wrapped up in towels. It's so funny, but they also convey messages in magazines. They've made videos. So people are using U equals U to make them look like them everywhere, all over the country. And then this one is from China or Japan? China. Just more messaging and commercials that people have made all over the world. Now, how are we doing here in the U.S.? Only 12 to 18% of residents across 7 states in southern U.S. and southern United States believe U equals U. Among those who argue U equals U was completely accurate, only 31 and 39% believe transmission risk was 0. 31% of HIV positive respondents reported U equals U accurately. But then 28% of HIV negative millennials said they have avoided hugging, talking, or being friends with someone who is HIV positive. We must talk about U equals U. U equals U is liberating, and it is saving lives of people living with HIV. I convey the message because I want people to feel free. We are not infectious, you guys. We are not a threat. And you share the message of U equals U to get people back in care, get people to stay on treatment so we can get to end transmissions and the epidemic. And now I'm going to introduce my sister in advocacy, Ariana Litt. Thank you.
Hi, V. Thank you so much for the presentation. And yes, thank you. I'm going to start my presentation with this fabulous and empowered slide, what you have right now in front of you. That is Dina, and that was one of the presentations in the plenaries in 2018 in the AIDS International Conference. And that's why it's very powerful, because one of the values of the U equal U is working with the prevention in the most vulnerable communities. As a transgender woman, trans-Latina, openly living with HIV, U equal U give us the platform to inform and to educate and prevent the HIV in the United States and in the world. So in the next slide, you're going to help, I'm going to help you, and we're going to talk, we're going to listen a little bit about the presentation and
the undetectable is untransmittable, or U is U message to become standard knowledge worldwide. It needs to sound louder every day, as this eases the burden of stigma and self-stigma of people living with HIV. It will save lives. It will reduce suicides and murders on trans sex workers especially. Leslie.
Yes, that is the fabulous and empowered message of Dina in the conference. And that is what especially U equal U means when we are touching the most vulnerable communities. As I repeat and I tell you, as a transgender woman living in the South, in the United States, and openly living with HIV, U equal U is the first resource and the first tool to everybody. They can use it and prevent the HIV in United States. But it's on risk. So I'm going to send you, we're going to talking about how is the best way to communicate the U equal U message. First of all, we have to be clear, confident, concise, and concisious, right? Tenemos que ser claros en el mensaje, tenemos que ser confidentes, de estar seguros, tenemos que estar consistentes de la educación que tiene sobre eso, y también tenemos que ser concisos en el mensaje, ¿verdad? Example, por ejemplo, no podemos decir, don't say negligent or extremely unlikely, virtual impossible, or close to zero. Oh, I am U equal U is close to zero. No. Health prevents. No. Health prevents. No. You have to say, can pass it on. Yo como mujer transgénero no, y viviendo con el VIH, no transmito el VIH porque soy U equal U o soy indetectable. So es imposible. Can pass it on. Can transmit it. No risk. Zero risk. And prevents HIV. That is the message. You have to be clear and don't thinking about it, because this is what the people they know, they already know. And the next slide, we have to see, don't say, I believe in U equal U, but I use condom or PrEP just in case, right? You can use PrEP or you can use condom because U equal U don't cover you from the STIs, but it's impossible you can get or HIV if you have if you indetectable. Do say condoms or PrEP aren't clinical necessary to prevent the HIV when U equal U. You mean you may want to say the use the condom and to prevent STI and pregnancy. So you can use a lot of condoms and a lot of lubricates, of course. And the partner with HIV is strongly with adherence. You know, I have a zero discordance couple many times relationships, and my partner was negative, and we never used condom because always was indetectable, and also I believe in the monogamy. So I think that is very important. You have condom-less sex of the parents and not the HIV status, or at the emotional feeling and security, secure and the agency. Next slide, please. So also be confident about U equal U. You have to be secure that you don't have nothing, because all the time when people living with HIV or when somebody living with HIV, they don't feel comfortable or they don't feel confident about the transmission or the risk. So this is very important to you feeling confident anywhere you can be, because the same people who they discover the HIV, the AIDS, they tell you right now, U equal U is the best tool to don't transmit the HIV. Don't say if you are only as good as your last viral load test. If you taking your medication as prescribed, if you are adherent and have a regular viral load test, don't worry about it. That is very important, and that all the time is my message. I always tell the HIV is not a problem. The problem is you don't know nothing about HIV. And that is what we have to start getting information. Don't say you never know. Say you do know. I know I don't transmit, you know? So that is one of the things. And the next slide have to be consistent about U equal U. Integrate into compliance information, guidelines, clinical rooms, outreach activities, and communications. That is very important. All the time when I working with the most vulnerable community over here in South Florida, maybe transgender who they are engaged in sex work, that is what I inform to. This is the best tool to use it, getting labs, getting indetectable. That is one of the of the information. Have a conversation about U equal U with those living with the vulnerable or communities and every opportunities. So every opportunity, that's why U equal U is around the world. And right now we are here with the Latino Commission on AIDS talking about U equal U and the best tool. Make U equal U the central to the speech and events and AIDS Walk or in other platforms. And that is very important to working. In the next slide, we have to talking about be consistent about U equal U, and the viral load does not equal value. Achieving and maintaining detectable viral load, go regularly to your clinic, recognize structural, social, and emotional barriers to make difficult to start treatment, especially in marginalized community. That's why we're working, in my case, when the transgender community or trans Latinas, who maybe the language is one of the barriers, so we can transmit that that information and the language they can feel comfortable, and the first language they have. Clearly, the treatment is a personal health decision and not a public health responsibility. Use the public health argument of the U equal U to increase access, to remove barriers to treatment and care. That is very important. The next slide, please. So let's talk to provide most inform the patients about the most informed patients about U equal U. So it's very important to providers to withhold the U equal U message to the patients living with HIV. I'm never get nothing about U equal U from my personal doctors until I ask. And that is very important to you have the open conversation and providers openly and free talking about the risk or the no risk about the U equal U. Combining benefits and risks, sovereigns and treatments is fundamental to patients, decision makers, and HIV treatment benefits. Education patients about U equal U. We're doing, you can see we have the campaign, we have a lot of information, a library in different language around the world to the message or the correct message of the U equal U, and they align with the treatment's goals. And educate patients about U equal U is crucial and maximum specific for people living with HIV. That is the most, one of the most important things also. And the next slide. Provider consensus. Telling someone they are infection is not it's not good, right? I don't feel it like people, they can tell me I am infectious. I am not infectious. And I think it's malpractice when hold or deny life-changing information for people living with HIV based on the same basis and acceptance. Patients will be find out about U equal U as we're breaking through trust between provider and patient. And that is one of the more important things for vulnerable communities or grassroots agencies or people. We are based in the truth and the trust. And if you lost the trust with the client, you don't have that connection. You cannot achieve what you want in the treatment for people living with HIV. Opportunities to improve personal and public health will be wasted. Second, next slide. Conseguir fears and answers. Recognize connective dissonances, separate feeling from the fact, consider the positive and negative impact all the time. I always believe when I try to break the stigma and what is the negative and what is the positive thing if I coming out like as a openly living in HIV, what I lost, what I get, you know. So that is one of the things. Very confident from the expert and strengths from voices of the people living with the HIV. The next slide. And the treatment is very important. Treatment, lab, and connections. You know, you have to find your best doctor, and the treatment have to be with undetectable, with less of 2,200 copies. And this time, and the time when I'm long time survivor also. So, you know, in my time, we have to wait until less of 400 viral loads to get treatment. Now you can get treatment as soon as you can have your HIV testing or your oral quick or whatever testing you use. So it's very important to have treatments, labs, and connections. And with this lab, was my pleasure to give you that information, and I'm going to pass with the other speakers. Thank you so much from South Florida.
Oh, it looks like we've got one more, and it has to come from U=U himself.
Hi, Allison. Today is marking a revolution in what it means to live with HIV. So thank you so much for your research. I have a question on behalf of the U=U campaign. There are many providers that are still not accepting this message. They try to focus on the risk is not zero scientifically, or they focus on their patients aren't going to be adherent and they won't know that they're detectable, or they say there's a rise of STIs already, so they don't want to share this with their patients. We get every single kind of excuse. What would you say to clinicians or any other information provider who is withholding this information from people with HIV?
Yeah, and I just want to pay tribute to the U=U campaign. It's been astonishing. I think the time for excuses are over. I think it's very, very clear that the risk is zero. So I very much think we have to promote this. I think if you're on suppressive ART, you're sexually non-infectious, and yeah, the time for excuses is over. And I again pay tribute to you and your work. Thank you.
Well said. Thank you, Alison. Great. Oh, it looks like we've got.
So join the revolution, train all staff, communicate clearly, speak out if you see incompetence about U=U, advocate with the U=U public health argument to increase access and remove barriers to treatment and care. Connect to the movement and join as a community partner and take part in social media with the hashtag U=U. Thank you. And now we'll answer questions. Join the campaign and learn facts and share the great news. You can go to preventionaccess.org/community. Thank you, everybody.
Hi, everyone. Thanks so much for joining. My name is Cameron Kinker, and I work with Prevention Access Campaign as well. I'm going to pose some of the questions that we have received in the Q&A box to our wonderful panelists. So let's see. One of our first questions was from Estrella, who asked, how long does it take a person to be undetectable after beginning their HIV treatment? Dee, do you want to take?
Yeah, some people become undetectable within 30 days. Some become undetectable in 2 or 3 months. It just depends on the individual. Not everyone becomes undetectable at the same time.
Absolutely. There was another question. What does U=U message mean for people who inject drugs? What is the message we should say to them?
Maybe Kim, you can answer that one for us.
Yeah, absolutely. So right now we don't have the science and the research to prove exactly what the risk of transmission is if someone is undetectable but sharing needles. That's why it's really important that we have syringe service programs that are providing those types of resources for folks. But we also know that people who inject drugs have sex, right? So it's really important to continue to share this information because you know, it can benefit everyone, even if it doesn't apply yet
to injection drug use. Hopefully we'll, as time goes on, there'll be more science that comes out that will give us more of that answer. Another question came in from Carmen. How does U equals U impact the HIV status disclosure among partners?
How does what?
How does U equals U impact sharing your status if you're with a new partner?
How does you? I'm not sure. It affects the different relationships in different ways. For me, that's kind of hard to answer because it's different for everyone. It's different for everyone. I don't know if you can answer it, Ariana. I don't know if I'm misunderstanding, but
yeah, I think it's different people and different ways. Stigma is one of the bigger problems for different communities or different persons, especially in the Latino community, or in the trans-Latina, or in the transgender community. But I think they help you to educate your partner and have a more commitment with your doctor, especially when I mentioned before, I have a zero concordance relationship in the past. Always I try to bring my partner to the doctor, put his name in the medical my medical history to know, to prevent domestic violence or possible domestic violence or something in the future or everything. And also it's more convenient when the scientific or the doctor explain to your parent, you are not transmitting the HIV, right? So it's different when they coming from your boys, maybe you be in love and you don't know, and it's different when your doctor tell, listen, it's undetectable for many years, she don't transmit and everything, and that is more trustable when I in my own experience.
Wonderful. Another question. Apologies. How do we get away from people having still having stigma of HIV testing and to even get them in care? Many people don't trust the actual testing of HIV to begin with, but with HIV positive people, I notice most I've talked to don't trust U equals U because the testing that goes along with making sure you stay undetectable is not as discussed as it should. We should have more education around that to teach all populations. Dear Ariana, I don't know if you have anything to add to that.
We should. We should have more information, and our physicians should be talking about it. The organizations should be talking about it. And that's why I said in the slides that it takes community of all of us together as a whole to constantly convey these messages of U equals U together, to get it out there. Talk to your doctor about it. There are some doctors that don't want to listen to it, but it's your body. You're the one living with HIV, and you continue to talk about it, even if your doctor doesn't want to listen to it, because you know the truth. It's hard. It's hard to get it out there, but we got to continue to keep talking about it.
And we got another question about asking why providers aren't sharing this information with people if there is such a benefit to U equals U.
They make excuses. That's what I can say. They say we're not going to understand. We might have condomless sex. And like I said, people have been having condomless sex for many, many years. You can't use U equals U because of that. TASK was around before U equals U. So now that the U equals U message is out there, it's like people want to push back, but we've known this for so many years. They say that we're going to think it's a cure. I don't know if they think that we're not bright enough to understand, but we are. And sometimes it's just hard to explain why a lot of physicians won't talk about it, but they should.
Yeah, and also we can prove in this time when the stigma start with providers sometimes, providers, they always don't try to share the information. And always, like my first time when I figured out about U equal U was for somebody else, and that was for a provider. So I think we have to educate providers and have a more open conversation and education about U equal U and the goals.
But also with providers, there are providers with HIV, a lot of them because they believe in science. They believed in the science of HIV/AIDS. So when they told us that we can transmit, now the science is telling us we can't. So it's the same people who were telling us that we couldn't, that we could transmit. Now they're telling us that we can't. So if they're your provider, they have to believe in science. I say print something from the CDC and take it to them and see what they have to say about it, because it's right there in plain written form that we can no longer transmit HIV.
Great. I think we can take one more question since we're at time. Someone asked, when there is U equals U and the patient is compliant, can the provider say that we do not need to use a condom?
I don't think your provider is going to tell you that. I'm going to be honest. We always say U equals U is not just about sex. It's about all these other things that we talked about. I always say U equals U is not about condoms. It's about letting us know that we are not infectious. It's helping us to feel good about our bodies and who we are. So a provider is not going to tell you not to use a condom. They may still tell you to use one. So, but that's just my take on
it. Okay. All right. Thank you very much, Ariana. Thank you very much, Dee. Besos. Kisses for both of you. Thank you very much for being with us and supporting our campaign and share the information that is so important to share about U equals U. And thank you, Cameron, for helping organize this as well. Thank you, everybody. This is our last webinar.
The only I forget, I'm sorry. The only I forget to say to everybody is that U equal U and Prevention Access Campaign give us a tool and resource to educate about U equal U. So if you want to becoming U equal U ambassador,
like us,
or coming, yes, like we are, they give us a trainings and resources to spread the work and help us eradicate the HIV and AIDS in the United States and the whole world. So that is the only thing. So thank you.
Yeah. Sign up and join. Sign up and join.
Thank you, everybody, for attending and participating and making those wonderful questions. It was a pleasure to have NLAAD 2020. We're closing the webinar series today, and we hope to see you again next year when we start NLAAD 2021. See you.